When we think about autoimmune disease or an arthritis related condition, we often think that it is seen only in elders. It is an age related problem, or we also think it might be only seen in adults, which is completely wrong. So what we must know is that autoimmune diseases and arthritis related conditions can happen from as early as 1-year-old child to 60 to 70-year-old people. So once this happens, it is very difficult for us to understand why a child has got certain conditions. So what we need to understand today is try and find out what are those symptoms in a child that can tell us that it might be an autoimmune arthritis or an arthritis related condition. Because children cannot tell pain, may not be able to express their feelings correctly. So as adults, it is our responsibility to identify these small signs, small symptoms, which can give us clues of a very dangerous disease which can be treated. So the first symptom or the sign would be that a child is limping. You might think it is playing around. The child might be walking on one toe all of a sudden, on the tiptoe of one foot, or the child might be kind of limping, which is a little abnormal for you. So this should trigger an alarm, and you should start thinking if this could be arthritis. The second thing would be that the child has stopped mingling with his friends, stopped going out to play. So this can mean a lot of different things, but then health related issues is one of the most important thing in such instances, and one of the most important health related issues that can contribute to less social interactions or less playing would be an arthritis related or any other autoimmune issue. Then finally, the child might get up crying every day. The child was fine till now, but now the child is crying every day morning because these arthritis pains are maximum in the morning. So if the child is worst in the morning, then start thinking of an arthritis related condition. Beside this, there are some very clear changes that you can see. The hands might be swollen, the foot might be swollen, knees might be swollen. So swollen joints are definitely a sign of arthritis, and you must seek attention immediately with a rheumatologist. So what are the conditions that are seen in children that can cause arthritis? The commonest condition is called juvenile idiopathic arthritis or juvenile arthritis. The second common condition would be juvenile lupus, that is SLE in children. Beyond this or beside this, there are a lot of other conditions which can cause arthritis, like juvenile dermatomyositis and lot of autoinflammatory syndromes that can cause arthritis in children.